This is the 13th video in the Ethics and Legal Considerations for Animal Chiropractic. And this video, I'm going to continue talking a little bit about record keeping. Now, again, this is a continuation of information that I think you should already be familiar with and should mostly be common sense for you anyway. Make additions and changes appropriately to your records. As I mentioned earlier, you don't want to try to hide, or you don't want to make it appear that you're trying to hide or conceal anything that you've done. If you find a mistake in paper records, then you want to draw a single line through the mistake so that it's still legible if somebody's trying to read it. And then you want to go down to the next entry, the next available date in your paper records, put down today's date and explain what the change is to the record and why you are making that change. And it should also, of course, include the signature of the person or initials of the person who is making that change. So that way in the future, if somebody is looking at this, they're able to see what was entered initially as well as what the corrected information is. Now, I don't think anybody expects us to be perfect 100% of the time. So it would be natural to expect to see changes in records or corrections in records. Um, and again, in the context of a software, if you keep records electronically, these software should create an audit trail. It shows, again, what was entered initially, when it was entered initially, as well as what changes were made and when those changes were made. Properly identify the record, particularly with paper records. You want to be sure it has the name of the client and the animal on it so it doesn't become confused or accidentally placed in the wrong file. Fill in all blanks. If you have a form that you use for an examination, fill in all blanks. If you're going to skip parts of the examination, explain why you were skipping those. Be careful about saying anything disparaging about the client. Avoid judgmental words. You want to be as matter of fact and straightforward as you can in your record keeping. Records should identify the record keeper. Who's the person creating this particular entry? Don't enter data prematurely. Sometimes it's tempting because you've seen this patient or this patient is coming in 3 times a week. You pretty much know what the routine is, and it can be tempting to go ahead and start creating the record before the patient arrives. And that may work out, but if the patient arrives and something is different, or if the patient misses that appointment, you have an error in your records that may be difficult to explain. Keep your records legible. For some of us, like me, that means you have to keep electronic records because my handwriting is, I can read it, but many people cannot. Be consistent in the way you keep your records from visit to visit to visit to visit. You don't want them to be identical, but you want them to be similar. If there's one visit where the records tend to be much longer, it's an indication that something unusual may have happened during that visit. If something unusual does happen, you should expect that. But on a typical routine visit, you want the records to be relatively consistent. Try to avoid contradictions, or if they do occur, make sure you explain those contradictions. Perhaps you observe that the patient has something about the patient's gait, and you make that observation as an initial observation or an initial examination finding. But after the patient has been treated, you notice something different about the patient's gait, improved, hopefully. And you may want to make both of those statements in the records, but you want to make it clear that one observation was made before the treatment and the second observation was made after the treatment so that it explains the contradictory information. You also want to document anything unusual that occurs. Avoid ambiguous words. Try to be as precise as you can be. Record all client-patient contact, all communications, all phone calls. Everything needs to show up in the patient's file. Don't criticize other providers, especially if you're involved in a referral situation with a veterinarian. You certainly don't want to be saying anything critical about your referral source. You also don't want to be saying things critical. Um, I think when clients see those critical statements, they have a very unprofessional opinion about the person who is critical. Don't make frivolous remarks. Your focus needs to be on patient care, not anything else. Try to use pens consistently. It looks unusual if you have used 5 different pens to make an entry on one day. Don't change or lose your records. It's okay to make changes that are appropriate and made in an appropriate manner, but sometimes it's tempting to just lose a page that's got a mistake on it. And that, when it's detected, can be a very costly mistake. As you receive reports, x-ray lab and consultants reports, or if you're a veterinarian receiving reports from a animal chiropractor that you are supervising, be sure that you read and initial those reports to acknowledge that you have read it. Don't just place those reports in the file without paying any attention to what they say. Um, in the world of computers, it's very easy to cut and paste, and that can be a mistake in official records. You want to make sure the records are personalized. You want to make sure the records are appropriate for each individual visit, each individual patient, each individual client. So there may be a lot of similarities between the notes from visit to visit, but there should be some personalization to reflect that this is not just a cut and paste. This reflects exactly precisely what happened with this patient in this visit. If you use abbreviations, make sure you maintain a legend for any codes that you're using. If you're keeping your records electronically, it's easy to set up the electronic system so that you can type in your abbreviation and it will expand it to the full word. You may or may not keep financial and clinical information separate. It depends on the nature of your practice. Now, I think many practices do keep it separate because it's just 2 different parts of the practice that handle those information. The healthcare professionals and the doctors are handling the clinical information, and there's staff in the front office that's handling the financial information. If you decide to use any forms that are published by others, make sure you customize them as appropriate. Certainly in today's world, it's easy to create customized forms. As far as how long you should keep records, I say here keep records forever. Pay attention to what's required by the statutes. Generally, the requirement for keeping records of animal care are much shorter than the requirements for keeping records for care of humans. Um, but pay attention and especially if the records are kept electronically, it just is not that difficult to keep the records long term. And there's something to be said for keeping them so that when a patient shows up 5 years after the last visit, you still have the records of what you did that 5 years ago so that you don't have to repeat that information. Review and archive files. Don't let your office become cluttered with paper. That was one of my bad habits, still is one of my bad habits. But you want to maintain a professional appearance in your office. You don't want to be digging through a bunch of boxes. You want to keep things readily available for your active files. If the client is being non-compliant, document their non-compliance. Proofreading any correspondence and reports. Again, typographical errors do not look professional. Too easy for the wrong word to slip in or for the wrong message to be sent. Take a second, proofread what you send out before it goes out. Be specific in your notes about what segments were adjusted, what technique was employed, what area or where the adjustment occurred. Uh, was it in a particular treatment room? Was it using particular equipment? Was it in the client's stable? Um, if it wasn't a stable, can you identify the stall where it occurred? And if something unusual were to happen, that may help you identify what went wrong in that particular situation.